Okay. Good afternoon, everyone. You're very welcome to today's press conference. Sadly, today we have confirmation of a further 14 deaths as a result of COVID-19. Our thoughts are with the family and friends of those people and with all those who have lost loved ones. Every life lost should be a reminder to us that the virus is still spreading and still killing people. People have been adhering to severe restrictions on their normal lives and social distancing for a number of months now. Those measures aren't easy for any of us, and we understand that people need hope for the future. So it's right at this time that we are preparing for recovery and planning for a phased relaxation of some of those measures. The Executive is working intensely on this plan. I also want to take this opportunity to express my sympathy to the family and friends of the late John Dallett, MLA. I worked closely with John at the Public Accounts Committee. He was always affable and keen to get things done. We were part of the same, sadly shrinking club of people who were first elected here in 1998 following the Good Friday Agreement, and my thoughts go to his family, friends and his party colleagues at this very difficult time for them. Yesterday, the 2020-21 budget was approved by the Assembly. This budget has been overshadowed by the outbreak of COVID-19. In response, ministers have been given flexibility to reallocate their resources so they can meet the challenges created by COVID. It's essential that ministers review their budget in light of the changed circumstances we face, identify where they now won't spend money as intended, and redirect those resources to the COVID response. The Executive has agreed over £1.1 billion of additional funding allocations to deal with COVID-19. A significant proportion of funding has gone to our health service, who are leading the fight against COVID-19. Nearly half of it has gone to support business. So far, over 19,400 payments have been made under the Small Business Grant Scheme, totalling £194 million worth of support. £95 million has been set aside for transport. Already some funding has been announced to support our airports and ferries. Funding has also been allocated to the vulnerable. £22 million has been set aside to support charities, social enterprises and the wider third sector who are experiencing extreme financial pressure in these difficult times. I am pleased to announce today that £6.75 million of this will provide urgent support for local hospices. Our hospices are there for people and their families when they need it most, and I doubt if there are very many families across this region, my own included, who have not experienced that support. This support package for them will help with the current challenges they are facing from loss of donations and revenue from their retail outlets. £3.2 million will go to the Northern Ireland Hospice, including the Children's Hospice. £1.6 million will go to Marie Curie. £1.1 million will go to the Southern Area Hospice. £600,000 will go to Foyle Hospice, and £250,000 will go to the Cancer Fund for Children. This funding will make a real difference to these organisations and to the families they support. Thank you.
Firstly, I want to join in expressing my sympathies to everyone who's lost loved ones in this crisis, and also as a fellow graduate of 1998 from the Assembly to pass on my sympathies to the family of John Dallett. The COVID-19 pandemic continues to present massive challenges for our society. As we approach a bank holiday weekend, I know that many people, like myself, will want to celebrate VE Day on Friday. I would simply remind everyone that we must continue to stay at home and adhere to social distancing guidance. People should not be holding street parties or other celebrations that would break social distancing restrictions. We must behave responsibly and not put others at risk by our actions. The message remains the same. Stay at home, only go outside if you have to, and where you do, follow social distancing guidelines, and wash your hands regularly. The health and well-being of the young people in our care and all our staff remains our priority. I again want to thank teachers and non-teaching staff for their tireless work to support not just our vulnerable children and the children of key workers, but the thousands of others who are being educated through remote learning. They have committed themselves to this task with distinction and innovation. Northern Ireland is a safe and well-resourced educational technology infrastructure which our young people benefit from through their schools. But I know that some young people do not have sufficient access to technology. So I have asked the Education Authority to work with schools to identify all of the existing resources that could be modified and lent to pupils, and I plan to supplement that with additional resources in the medium term. In responding to this emergency, we've collaborated closely with other sectors. In terms of school clusters, schools have been accommodating children of key workers and vulnerable children every day. Every day there are around 470 schools open, accommodating over 1,300 children, with this figure rising steadily after Easter. We have 32 clusters of schools pooling their resources. In terms of childcare settings are enabling key workers to work knowing their children are safe and receiving the best possible care. My department has worked closely with the Department of Health to bring forward the recently announced £12 million package on childcare support. This important package of measures will ensure a number of registered and daycare settings, school-age childcare settings and childminders remain open for vulnerable children and the children of key workers, as well as doing what we can to support the sustainability of the wider sector. Application forms will issue tomorrow to childcare providers who are eligible for financial assistance under this scheme. Work to protect vulnerable children in partnership with our health and social care colleagues continues. My officials are working with the Education Authority and Health and Social Care Trusts to ensure that there are processes for maintaining contact with vulnerable children and their families and for accessing these services that they need. Multidisciplinary panels of health and education professionals are considering the needs of vulnerable children attending special schools and other children with complex needs. Over 54,000 families covering 98,350 children are receiving direct payments for free school meals, with over 7.7 million paid to date. The Education Authority and the Department for Communities are working to help the small number of families who do not have bank accounts. Anyone in critical need of food should contact the community's COVID-19 helpline where they can receive support. Alternatively, you can text action to 81025 or email covid19@advice.ni.net. My department is also working with the Department for Communities and the Education Authority Youth Service to deliver the Eat Well, Live Well programme for a further 3,000 vulnerable children. Finally, on the issue of schools, for many parents and carers, the timescale for the reopening of schools is of crucial importance, and there has been much speculation on this. Let me say it clearly that there is no planned date for the reopening of schools for normal business. Any decision of this will be driven by the circumstances, guided by scientific and health advice, and will not be date-driven. Many issues need to be addressed before schools could reopen. We are quite sensibly embarking on planning work to consider and scope these issues, and I'm committed to full engagement with all relevant stakeholders, including schools and school leaders, before any decisions are taken. Whenever schools do return, it's unlikely that this will be on a business-as-usual basis. There is likely to be a phasing of the return of pupils alongside a continuation of some form of remote learning. And at all times, the well-being and safety of our pupils and staff will be our key priority.
Thanks very much. Good afternoon, gentlemen. Tracy McGee from UTV. You say that you're working intensively to get a roadmap together for unlocking the lockdown. Can we expect this tomorrow? And if not, why not?
Well, I sincerely hope we will expect this tomorrow. We had a discussion on Monday among the executive ministers, quite a lengthy discussion, and there has been ongoing work and exchanges of papers all week in relation to this, with the intention of having something announced tomorrow. But these aren't simple decisions. The behaviour of people in terms of social distancing and lockdown has, with very, very few exceptions, been absolutely outstanding, and we understand the pressure that has put people on and continues to put people on. And it is important to give, at the earliest possible time, a signal to people that there is light at the end of this tunnel and that we will begin to move towards slightly more normal society again. But there are huge issues that rise. These aren't just simply a matter of lifting restrictions. The consequences of doing this will have severe implications for our health system. The consequence of doing this wrongly could have severe implications for people's lives. And the measures that need to be in place to support the easing of restrictions to deal with what will likely be an upsurge in cases of coronavirus then have to be managed through our health systems. And so those are all complex issues that have to be put in place. So while the intention is clearly to have this ready for tomorrow, and quite a lot of work has been done in relation to that, we're not driven by a date, even though the review is formally to take place by the 9th of May. What we, more importantly, is getting this right, getting the measures correct, making sure the message is understood, and making sure that the necessary arrangements are in place to manage this. Hopefully that can be achieved by tomorrow, but I'd be more concerned about getting it done correctly rather than rushing to an early decision to meet a deadline.
Yeah, I would agree. It is important that we give certainty to people as soon as we can. It is also important in these difficult circumstances that we give hope to people as soon as we can. But this will actually be part of a wider decision within the executive, which is probably the most crucial decision that this executive will ever make. So it is critical that all the details are got right, because both the health, our economy, our education system are all dependent upon us getting certainty and getting this correct. So we will work together collectively and intensively to reach a successful conclusion on this.
Good afternoon to Ministers Murphy and Weir. Stephen Walker, BBC. A question to both ministers. I wondered if you were both asked to go to London, whether you would fly at the moment, and do you accept that there is conflicting advice around at the moment over airline safety?
Well, if we haven't been asked to travel, and clearly if there was an opportunity to do any of our business which might be needed to be done in London or elsewhere outside of the island of Ireland, then we would look in the first instance to do that via technology, as we've been doing quite a lot of our meetings remotely, and that's been the practice of the executive for the last number of weeks and months to do that. I think very clearly you can see, as people are remarking on the fact that certain sectors are already starting to go back to work, then it's not just the consequences of those sectors being in work, but how people are getting to that. And quite clearly that caused an issue at Belfast City Airport yesterday. And so the Health and Safety Executive are looking at the issues which were raised in relation to that. I know that Aer Lingus have acted swiftly and are conducting a review on the suggestion of an additional flight to ensure that there is an ability to social distance if people have engaged in what is essential travel to work in London. But clearly our guidelines are, if it's not essential to travel, don't, and that would apply to all of us as executive ministers. But for those who have to travel, we want to make sure that the Health and Safety Executive are on top of this, ensuring that safe measures are put in place to support that. And I know that the airline company involved and Belfast City Airport are both very keen to play their part in ensuring that that happens.
Well, I welcome the fact that there's been a review into this by Aer Lingus. It is important that in all spheres of work that social distancing is observed and we have that appropriate level of response. I think there's also a clear message that both in terms of working from home and indeed trying to communicate with others, that as much as can be done through the electronic means, I think should be copied. And I think in most cases that can mean then that a level of remote discussions can take place. But it is important that we protect the health and safety of everybody as we move ahead.
Good afternoon, Ministers. David Young here from PA. A question for each of you, if you don't mind. Firstly, to the Education Minister, you said you don't have a timeline yet in regard to school opening. The question is the current structure of the school year in regard to when the summer term ends and when the autumn term begins, will that remain in place? Or could you envisage a scenario where if in the middle of July or the middle of August it is deemed safe that schools can then open?
Well, look,
schools actually open then?
It isn't. Sorry,
I was just going to ask a question to Minister Murphy, if you don't mind. There have been reports that the Chancellor is starting to consider when furloughing may be brought to an end. There's talk that it could either be tapered out in June or July. To the question of the Finance Minister, firstly, does he think that's too early? And if he does, is there potential for Stormont in any way to to mitigate those payments, similar to what has happened with welfare payments, if the payments are slightly reduced by the government in the UK?
Well, David, I can deal first of all with the question in terms of school reopening. We've indicated, and I think collectively it's got to be part of the overall position of the executive, because education is interlinked with health, with economy, and indeed plays a critical role. And as such, I suppose we're talking about things that are condition-led and circumstance-led rather than time-led. To that extent, I think we may need to look at whether there's any level of flexibility in terms of the school year. And from that point of view, exact dates may not be sacrosanct on that basis. But it is also the case that if we look at reopening, that is going to be something which cannot at any stage happen overnight. There's got to be a level of lead-in period, particularly for schools to prepare on issues around social distancing. So I believe it's important that when we come to the point at which a realisation in which that level of reopening can happen on a phased basis, that there's plenty of notice given to schools and also to parents, so they're able to do that level of preparation for the level of resumption of direct school activity through any form of reopening.
Yeah, can I say in relation to the job retention scheme, it's been hugely important intervention by the government in London, which has obviously supported employees and employers through a very, very difficult phase, and actually stopped our own social security system from being overwhelmed in terms of layoffs and redundancies that would otherwise have happened. I am worried that the ending of this in June is too soon. I think certain sectors are already starting to return to work, and others may follow in the time ahead. But clearly some sectors are going to continue to suffer from an inability to work, even if restrictions are lifted, the inability to operate at full pace as they were doing up to the outbreak of this pandemic. So I do think some analysis needs to be done in terms of the sectors that can return to work, that have returned to work, and those who are not able to do so. And we will obviously be, as we have been on a weekly basis, talking to Treasury in relation to these matters, and talking to business organisations and other employees and employers here as well. Can I say the system's based on the HMRC database, which we don't have. So the ability for the executive to pick this up and to try and operate similar payments, firstly, I have no doubt would be hugely costly in terms of what limited resources are available to us, but also it's paid directly through the HMRC database directly to employers and employees. So that would present another very significant obstacle to that. But I think in the first instance, we will make a case as we get a fuller understanding from the Treasury in London as to what their intentions are. We'll certainly be making a case in relation to those areas which will have a real difficulty in getting back into full-time work anytime soon.
Good afternoon, Ministers. Lauren Hart from the Belfast Telegraph. Two issues for you both, if possible. Firstly, on the issues of care homes, Ministers, could I ask if care homes are at the front line of the coronavirus fight, why are we not getting daily figures and why haven't they been included on the daily dashboard? And secondly, is there any data on how many people who have died in hospital after contracting the virus in a care home setting? And I asked that in the context of comments from an expert from the London School of Economics who said the measures put in place to protect local care home residents from COVID-19 are inadequate and that officials could have done more to prevent the spiralling death toll. Secondly, we've heard suggestions today from business leaders in cross-border areas that the reopening of the economy in Northern Ireland could be coordinated with the Republic's plan. They say it would be helpful in terms of cross-border travel to be in step with plans in the Republic.
Well, look, if I can just touch on those points, and I know Conor will probably come in particularly on some of the detail as well in relation to that. Look, in terms of the production of the data, I understand certainly in terms of care home gathering the information, that in other jurisdictions as well, that has been done effectively on a weekly basis. And so therefore the ability, because it's being gathered up from a number of sources, isn't just there to the same extent as quickly as it can be with hospital deaths. The important thing is to try and provide as full a pictures as possible, and indeed, if we're in a situation of simply saying when particular things have happened, there may be a limited value to that. But it is critical, I think all of us will have relatives who've been in care homes, who have maybe in care homes at present. And so as an executive, I think we're very much seized of the importance of this to the community and the very difficult position that families of those in care homes have been put in, many of whom have not had the opportunity to see or speak to their relatives in a long period of time. In terms of trying to synchronise activities, clearly we will look to see what's in the best interest of Northern Ireland as a whole, but we'll be looking at there's obviously links across a range of jurisdictions, and to that extent, when we come to reach decisions on business levels or indeed other aspects, we'll be looking both north-south and east-west to try to make sure that we have something that is compatible across the piece as possible, and obviously something particularly that operates in the best interests of our local economy and our local society.
Yeah, can I say I share the concerns in relation to care homes and the need to ensure that they are adequately protected and patients in them are adequately protected. Peter has outlined the difference in approach from the PHA gathering up the daily figures in relation to hospital deaths and the requirement then in terms of certification of deaths outside of the hospital and the attempt to collate those on a weekly basis. Can I also say that and I know that there has been some additional resource given to care homes by the Health Minister in recent weeks as well, and I hope that goes some way to addressing what is clearly a growing concern about the number of deaths in our care homes. In relation to the cross-border and the synchronisation of emergence from lockdown, I mean, if you set aside the constitutional and political debate in relation to this is about protecting life. And our Chief Medical Officer has advised us in terms of the course of this pandemic that we are on a similar trajectory to the rest of the island, and we are on a different trajectory to what's happening in Britain, and that's very evident from the deaths and the impact that we can see daily on our television screens. So, as a border dweller myself, and thousands more like me on either side of the border, it makes absolute sense to ensure that there is a clarity of understanding about how restrictions have been entered into and how they are being lifted and what the consequences of that are for behaviour, both in business terms but also in individual behaviour as well. And so I know that there is a memorandum of understanding between both health departments, north and south. There are a very regular engagement between the leaders of the executive and the senior government ministers, the Taoiseach and the Taoiseach as well. And I think we do need to ensure that we have coordination, because I think it's the best way of having a very clear and clearly understood message by all the citizens who live on the island, not just in the border areas, and ensuring that we manage our exit from this tragic situation as carefully as we can, which doesn't create unnecessary deaths or unnecessary suffering.
Good afternoon, Ministers. Shauna Core here from Belfast Live and the Daily Mirror. I have a question for both of you, if you don't mind. So, Minister Murphy, you spoke about 1.1 billion being set aside for coronavirus. Do you have any idea at this stage if that's the total amount of money that this pandemic's going to cost the economy? And to the Education Minister, Peter Weir, you've also sort of touched on the issue of children that are entitled to free school meals that haven't been receiving payments. Do you know how many that has affected? And could you go into a bit more detail about what's being done to help those families? Please, thank you.
Well, can I firstly say in response that the real cost of the COVID-19 outbreak has to date been 418 deaths, and that is immeasurable, and all of the associated suffering and illness that has gone on with that and the damage to families and communities is immeasurable in terms and financial terms. The 1.1 billion that we've referred to was money which came directly to us from London to assist in the response, and we have thus far I think spent something over 900 million of that, and we have ring-fenced certain other monies, and we are holding back some money till the executive agrees how to reprioritise what is left of it. We have no indication as yet that there'll be any further money coming from London in relation to that. The executive itself has spent from our own resources quite a significant amount in tackling COVID-19, and we have given flexibility to departments to money that they would otherwise have spent that they clearly won't be spending at this time to try and reprofile that to assist in the fight against COVID-19. So it's substantially more than 1.1 billion, but I mean, I think in reality the true cost of this is in suffering and the loss of life.
Okay, in terms of the figures on free school meals, so far the exact figure is 98,273 children are benefiting from direct payments. That is paid directly through a bank account, and indeed is borrowed from the system of the Education Authority, who pay out uniform grants. And the uniform grants are done directly through a bank account, which requires a bank a bank account number and a sort code, which is why it is restricted to it. But it's also meant that we've actually been able to deliver that, whereas in some other jurisdictions, for example, where vouchers have been provided and provided through local authorities, it's been a lot more of a bitty situation. Of those who are entitled to a free school meal but have not been paid through a bank account, there are 1,812. In some cases, because that is entitlement. In some cases, that has been because the person entitled and the family entitled have said that they don't want payment, that they are happy to rely on their own resources. In some cases, that is because those are some newer people that have come onto the system, because clearly, as universal credit has moved on, there's some people, and there's others who have not submitted bank account details. The EA is working directly with everybody who's provided a bank account has been paid. At least it would be provided by the latest date. Those figures are accurate as of the 4th of May. But there is within the EA, there are people who are helping anybody who doesn't have a bank account to be able to give advice in establishing that. And similarly, there is also helpline, email address, text for those who actually find themselves in difficulties as regards food. And consequently, allied with what the EA is doing in conjunction with the Department for Communities, there's also delivery on a daily basis to a range of vulnerable families, including children who are provided with those meals.
Thank you.